Okay, so today I'll be sharing about the myth and facts about physiotherapy during pregnancy. So this is actually the part 2 of our myth and facts series. So you can actually just look back at the previous ones if you have missed the first one. Okay, so a little bit about myself. My name is Kelly. I'm a physiotherapist at EMW, where we actually incorporate physiotherapy and TCM treatments for a lot of cases. I'm specialized in women's health, so I'm seeing a lot of women's health cases, be it during pregnancy, post-delivery, or even when you're trying to get pregnant as well. And also a lot of pain management for people who have facing a lot of pains when they are actually doing work or doing their daily activities. So let's get started. So for the first question, okay, we are not allowed to go we are not allowed to have our heart rate go above 130 during an exercise. This is actually a myth that a lot of people do believe in, when actually, in fact, we should be monitoring our RPE scale, which is the colored ones at the side of this slide, instead of just monitoring the heart rate during exercise. It would be easier for us to use this scale, as there are other things that will actually affect your heart rate, like the trimester that you are in and also your stress level. So try to keep your exertion level between 5 to 7. So question is, how do we actually use this scale? This is actually how you are feeling at that point of time. So have a small break. Ask yourself, when you are exercising, which level are you at? Do you find that this exercise is very easy, a little bit easy, a little bit hard, really, really hard, or you feel like you're just going to give way the next minute? Okay, so based on how you are feeling at that point of time, you can actually grade your skill. So you should just be feeling that the activity that you are doing is a little bit hard to a really hard level, but not super hard. Okay, if you feel that you are going really hard, you might want to consider to slow down a little bit when you are doing your exercise. Okay, so the second question, I should not start any exercise when I'm pregnant if I have never exercised before pregnancy. This phrase is actually possible. It is a yes and a no, but it's not fully on one side. So the fact is, if you have not tried things like yoga and Pilates prior to pregnancy, now might not be a good time for you to start to do it alone at your house. Yoga and Pilates often bring us to the extreme range of motion of our joints for stretching, and this might result in stretching your joints too much. So if you have been doing yoga previously and really enjoy doing it, you can still continue to do it by a trained yoga instructor who supervises you during the session. And your yoga instructor should be someone who actually focuses on doing pregnancy yoga instead of just a normal hot yoga or other forms of yoga. However, instead of trying to avoid all forms of exercise when you are pregnant, try to start slow and gradually increase the duration and the intensity of your exercise if you have never exercised previously. Simple exercises such as taking a daily walk for about 10 minutes can actually help to reduce the fatigue during pregnancy and help you to sleep better at night. So if you are finding it hard to incorporate your daily exercise into your routine, you can just try to start off with going out for a walk with your partner after dinner every single day. And then you can gradually increase the duration or the speed to make it a little bit harder for you. So I should not run during pregnancy. This is actually a myth, whereby a lot of people think that even if they do run before pregnancy, they are not allowed to do so because of the high impact. However, if you are a runner before your pregnancy and you and your pregnancy are healthy, there's actually no reason for you to completely stop running. You can continue to run at a comfortable pace. However, it is important for you to take note that you should not be pushing yourself too hard while you are pregnant. So after the second trimester, you will notice that your running speed and distance will reduce. Most women will actually stop running in their third trimester as it makes it become uncomfortable. This does not mean you have to stop all your exercise. You can still continue with low intensity and strengthening exercises during the third trimester as your baby gets heavier, but there's no real need for you to completely stop all your exercises. So it is not safe to do any abdominal work during pregnancy. This is actually a myth. So in fact, core strengthening, including pelvic floor muscles, should be done throughout pregnancy. This will not only help you to maintain a good posture during pregnancy, it will also help you to shorten the duration of labor, reduce the risk of cesarean and operative assisted vaginal delivery, and also your recovery as well. Studies have shown that core strengthening, if done properly during pregnancy, can help to reduce the risk of rectal steatosis, meaning the splitting of your six packs, and also recovery from it, as well as preventing low back pain both during and post-pregnancy. So pregnancy can make you more prone to certain fitness injury. This is actually a fact. So during pregnancy, our body produces more relaxin, a hormone that actually assists in the delivery itself. However, when the joints are too relaxed or lax, the risk of injury actually increases. So try to avoid activities involving the dead muscles or joint movements. So things like heavy lunges and deep squats, okay? You can still stay within your pre-pregnancy range. However, try to avoid carrying heavy weights or squatting deep post 30 weeks into your pregnancy. So if I exercise during pregnancy, it is not good for the baby. This is actually not true. So in fact, exercise is good during pregnancy. Studies have shown that the blood flow to the fetus is actually not significantly altered by moderate intensity physical activity. However, we should not push ourselves too much when we are exercising during pregnancy. Start slow and gradual progress if you are sedentary previously. So if you are the type who actually just sits in front of a computer, not doing any activity prior to your pregnancy, start slowly. Make sure you are already comfortable with the level before you push yourself even further. If you are actually already active pre-pregnancy, keep it up. But it's also important for you to note that as your pregnancy progresses, you need to listen to your body and slow down when your body tells you to do so. Not every exercise is safe to do during pregnancy. This is a fact. Exercises with high risk of fall, like biking, skating, rollerblading, or contact sports like judo or soccer, can actually be risky during your pregnancy. After the first trimester, your balance will be affected due to the hormone relaxin. So try to avoid putting anything that puts your body in an unstable position. So I should be eating for 2 persons during pregnancy as I need nutrients for my baby. So should we really be doing that? It's actually no, we should not. So although you will need more nutrients to meet your baby's growth, it is still important to eat a balanced diet and do not overeat. Studies have shown that binge eating increases the risk of you having a miscarriage, increases your labor time, and also giving birth to a premature baby or a baby that are slightly heavier than normal. This is actually not good for both you and your baby if you eat for 2 persons. Okay, so the common problems that many women face during pregnancy include things like back pain, pelvic pain, bladder and bowel control issues, fatigue, foot swelling, gestational diabetes, feeling of breathlessness, and preeclampsia, which is actually characterized by having high blood pressure, fluid retention, and protein in the urine, most commonly seen in the second trimester. There are actually many physical and psychological changes to the mummies during the pregnancy. Other than the changes in the hormones, our body shape, and also increase in urinary frequency, mummies also faces changes in their role expectation. So instead of just having to be a wife, now you have to take care of a child. You are expecting a baby for your child, for yourself and your husband, and your role changes from being just a wife to being both a wife and a mother. So stress and mental health and pain also makes the mummy feels very, very different during the pregnancy. During pregnancy, due to the increased weight of the baby, we actually have a tendency to shift our upper body backwards in order to bring our center of gravity back to neutral, so as shown in the picture below. So this causes unnecessary strain on our low back. Furthermore, due to the increase in relaxin, the hormone that actually inhibits contraction to the uterus to prevent premature childbirth in the early stages of the pregnancy, and make our joints soft during the delivery so that your baby can come out easier. Some women also do notice that they have an increased risk of getting a pelvic pain or discomfort during pregnancy. Actually, if you're expecting a twin or a triplets, the chances of you having pelvic pain or discomfort actually also increases compared to if you are just having a single-term pregnancy. So a physiotherapist can actually help you with postural correction, guiding you proper exercises that help you strengthen your muscles to prevent low back pain and pelvic pain, and also to perform manual therapy to reduce pain. So this is the correct sitting posture. When you are sitting, try not to slouch. Sit all the way back into the chair as shown in the arrow, with the lower back resting against the backrest. So after that, pull your shoulders back and tuck your shoulders and chin in. Try not to poke your chin out or slouch forward with your upper back because it does cause discomfort and a lot of back spine problem and posture corrections needed in the future post-delivery. This is the correct standing posture. So this is actually the wrong standing posture. As you can see, she actually sways backwards and arch her lower back a lot in this picture. So when standing, try to avoid leaning backwards. So in this picture, we actually just got her to lean forward a little bit and shift the belly inwards instead. So lean slightly forward from your upper back, tuck your pelvis underneath you and tuck your chin in. Do not poke your chin out or round your shoulder. So keep this upright posture when you are trying to stand. Getting into bed. So to get into the bed, lie on your sides first, turning onto your back. Let me show you the video. So lie on your sides first, turn onto your back, and then slowly straighten your knees. After you enter your second trimester, try to avoid lying on your back for more than 5 minutes to avoid exerting extra pressure into the veins that carries the blood to the lower body. Try to sleep on your sides at night. Okay, so how to get out of bed? To get out of bed, turn to your sides first. Gently bring your legs off the bed and push yourself up with your hands until both your feet are on the ground. Okay, so this is actually a compilation of videos of how to not lift items off the floor. Many times we try to just bend our back. Okay, so always try to squat down. However, do not just lift the items far away from you. Bring it close to your body before you try to stand up, like in this video. So bend your knees to squat down before attempting to reach for the items. Bring the item close to the chest and then bring it down, bring it up with you. So to put an item down below waist level, squat down with the item close to your chest before lowering it. Avoid carrying heavy weights during your pregnancy. Always ask a family member to help you to get the item if possible, or carry the items in small batches if really necessary and there's no one else who can help you to do it at home. As your baby grows bigger, you will notice that there's an increase in urinary frequency, or sometimes it might be hard for you to hold your urge until you reach the toilet. This is due to an increase in the blood flow, which makes your kidney works over time and releases extra fluids, which results in extra urination. In the third trimester, you will also feel increased frequency and urge due to the pressure of your baby pressing on your bladder. The increase in urine frequency would usually resolve around 6 weeks post-delivery. Although the symptoms of urine frequency generally resolve around 6 weeks post-delivery, it is still important for us to train our pelvic floor muscles to prevent incontinence and uterine prolapse post-delivery. Although there are many resources online that claims to guide you on pelvic floor muscle strengthening, we tend to do it incorrectly by activating other muscles as well. So it will be beneficial for you to look for a trained women's health physiotherapy. So in this slide, I actually have this machine that will be able to read the EMG levels of your muscles. So what we need to do is just use the machine with the probe. We will be able to know how much you are actually contracting on the probe and turn it out into numbers that you can see your own progression instead of just having to feel and imagine all the activities that you are supposed to do when you are doing a pelvic floor training. So this is a wrong pelvic floor activation. Most of the time, we will just squeeze our buttocks together as shown in the video. However, this only activates your glute muscles and not your pelvic floor. So do not squeeze your buttocks. When you are trying to feel the action of a pelvic floor muscles, imagine you are trying to stop the flow of your pee or hold your bladder when it is full. When you are able to find the muscle, practice the action, but do not practice the activation when you are peeing or when your bladder is full. The movement is actually very small as shown in the video, just around the 2 arrows. So you should be able to see a very, very gentle lifting in between the arrow and then relaxing. And most of us don't really see unless you really stare at it very closely. It is easier done when you are lying on your back, followed by sitting, and then standing, and then you can also do it during activity as well, although it will be hard for you to start right from the beginning. If you are still having problems trying to activate your pelvic floor, a physiotherapist can help you to assist the activation through electrical muscular stimulation like what I showed you previously. As your pregnancy progresses, you might find it hard to lie on your back to do your core exercises. You can instead do it in a 4-point kneeling position where your shoulders is in line with your palms and your hip is in line with your knees. Gently tilt your pelvis forward and backwards for a few times. Note the highest and the lowest point, and then find the midpoint. Keeping your pelvis in this position, gently tuck your tummy in and hold for 5 to 10 seconds. Do not hold your breath during this period. Breathe normally. If you are able to do this exercise easily, you can also include your pelvic floor activation together with your core activation. So let's take a look at the video. So gently tilt. Just a couple of times to note the highest and the lowest point. After you find the center point, which is right between the highest and the lowest, pull your tummy in. Okay, so you should be able to see the tummy going up a little bit. If you find this too easy, you can always try to activate your pelvic floor muscles together while you're doing this. Do it for about 2 breaths before relaxing. Try not to hold your breath when you are doing any exercise. It's not good for your blood pressure. Okay, so this is a modification or a progression for the core exercise. So what we need to do is just to do the exact same movement with a backwards straightening of your leg. So you can do it alternating leg, but try to keep your pelvis and your pelvis stable and keep your core there as well. Do not move your core when you are doing the exercises or tilt your pelvis. Okay, so edema, commonly known as swelling, often occurs on the foot and ankle during pregnancy because of circulation. If you notice that the swelling occurs somewhere on the face or the hand, this might be due to the preeclampsia that I mentioned earlier, and it will be good to have it checked out by your doctor instead. However, if the swelling is around your foot and your ankle, it is not harmful to you or the baby, but it might feel a little bit uncomfortable for you. Our feet swell during pregnancy mainly due to the increase in the blood in our body to help your baby grow, and also because the walls of the veins are softer, making it difficult for it to work properly and pump the blood back to your heart after the circulation. Due to gravity, our feet generally tends to swell later part of the day, especially if you spend a lot of times on your feet or if you are doing a lot of sitting. So usage of compression stockings and also elevation of the legs can help to reduce edema. However, physiotherapists can also assist by teaching you some gentle leg exercises to help with the circulation, and also teach you gentle leg massages to help to reduce the swelling. So if your swelling is very bad, you can always bring your husband to us together with you, and we can teach both you and your husband to do the massages at home. So usually patients will do it around the time when they are about to go to the bed, so they can actually just get it a little bit more relaxed. So next up, leg cramps. Often pregnant mummies tend to feel cramp over the calf area, generally in their second to third trimester. There is no clear explanation of how and why leg cramps occur for pregnant mummies. However, some theories believe that it might be due to the reduced circulation in the legs, or because the uterus is pressing on certain nerve, or due to fatigue of carrying a baby and your own body weight throughout the day. After an episode of cramps, we often feel discomfort around the calf area, making it difficult for us to step properly on the legs. Physiotherapy can help to teach you gentle stretches and massages to help to reduce the discomfort post-cramp. If you find it hard to massage your calf area by yourself, due to the growing size of your baby, you can also get your partner to do it for you. Usage of compression stockings and doing stretches before you go to bed do help to reduce the incidence and duration of your cramps. Keeping your legs elevated when you are sitting not only helps to reduce the swelling, it also reduces the incidence and durations of the cramp by reducing fatigues to your calf muscles. So what are the exercises that are safe to do during pregnancy, as things like yoga and Pilates are not very good for you if you are doing it unsupervised? So in general, exercise like brisk walking, swimming, aqua aerobics, riding a stationary bike, gradual strength training and core strengthening, closely supervised yoga and breathing exercises are safe to do during the pregnancy. You can always mix a variety of exercises within the week to make your exercise program less boring and mundane for you. Try to find the exercise or activity that you are interested in and try to start from there. If you have any doubts about what exercise to do, you can always ask your physiotherapist. They will be able to work together with you to find an exercise program that is both safe and fun for you. There is no real need for you to start an exercise that you do not like. Try to find things that you like and you are willing to do together with your husband or your family members and friends, so that you will be more motivated to continue in the future. So with that, I come to the end of my presentation. Is there any questions? Okay, since there's no questions, if you do have any questions in the future, feel free to drop a comment in our video or even message us through Facebook. Okay, thank you. Bye-bye.